Hello, everyone. Welcome to Health Series Podcast. Today, we're going to be looking at the topic, the healthcare system of Nigeria versus that of Rwanda. Comparing the healthcare system of Rwanda and Nigeria offers an interesting perspective on two African countries with distinct approaches and achievements despite familiar similarities and challenges. The first area we're going to look at is governance and policy framework. Nigeria has a decentralized healthcare system. Health policy is divided among the federal, state, and local government. This multi-tiered system has led to significant variation in healthcare quality and accessibility across regions. The National Health Insurance Scheme, NHIS, introduced in 2005, was intended to make healthcare more accessible, but coverage remains quite low due to administrative challenges and limited funding. On the other hand, Rwanda has a more centralized system with strong government-led initiatives. The Ministry of Health plays a prominent role in policy direction and resource allocation. Rwanda's community-based health insurance, which is called CBHI, has a hallmark, achieving high coverage levels and ensuring affordable healthcare for majority of the population. Looking at the healthcare financing, starting with Nigeria, despite its large economy, Nigeria's healthcare expenditure as a percentage of GDP remains relatively low. Funding is predominantly out of pocket, which limits access to healthcare for many citizens. International aid and donor organizations contribute to healthcare financing, but budgetary allocation for healthcare remains inadequate. On the other hand, Rwanda allocates a higher proportion of its GDP to healthcare. The government actively invests in healthcare infrastructure and services, and its CBHI has become a sustainable financing model supported by mandatory premiums and government subsidies. Rwanda also receives substantial international aid, particularly for HIV/AIDS, malaria, maternal and child health programs. In the area of healthcare infrastructure and workforce, Nigeria has a large but unevenly distributed healthcare workforce with a significant urban-rural divide in healthcare resources and services. Facilities are often inadequately equipped, especially in rural areas. Brain drain, which is a major issue as many healthcare professionals immigrate for better opportunities, further straining the system. Whereas Rwanda has invested in training and retraining healthcare workers supported by partnerships with international institutions, the government has made a concerted effort to build clinics in rural areas, improving healthcare access. Additionally, community health workers play a key role in providing primary healthcare services, especially in remote regions. When it comes to access to healthcare, Nigeria's access to healthcare is a significant issue with rural populations particularly underserved. The NHIS has struggled to reach a broad segment of the population due to various systemic inefficiencies, and a majority of Nigerians still pay out of pocket for their healthcare needs. On the other hand, access to healthcare in Rwanda has improved significantly through the CBHI and the focus on primary healthcare at the community level. The government has also invested in infrastructure to bring healthcare services closer to the people, achieving greater accessibility even in rural areas. When it comes to technology and innovation, Nigeria has growing health tech sector with innovations in telemedicine, mobile health, and electronic health records. However, the adoption of these technologies is often limited by infrastructural challenges like inconsistent power, internet connectivity, and the likes. Meanwhile, on the other hand, Rwanda has embraced technological innovation as part of its healthcare strategy. For example, drones are used to deliver blood, medical supplies to remote areas through partnership with Zipline. The use of mobile health solutions is widespread, and the government actively supports digital health innovations. In the area of health outcomes, Nigeria lags in areas such as maternal and child mortality, life expectancy, and the prevalence of communicable diseases. Efforts to improve these metrics are hindered by funding gaps, inadequate infrastructure, and healthcare workforce challenges. Whereas Rwanda has seen improvements in health outcomes, particularly in maternal and child health, thanks to its focus on primary care and preventive life services. Life expectancy and mortality rates have improved significantly, and the country healthcare reforms are often cited as a model for low and developing nations. In conclusion, Nigeria, with its large population and more complex federal structure, faces challenges in achieving equitable healthcare access across region. Rwanda, on the other hand, has leveraged its centralized model to build a more equitable healthcare system with a strong focus on community health. Rwanda's success with CBHI and community-based healthcare delivery demonstrates a viable path for healthcare reforms in Africa, while Nigeria's challenges underscore the importance of funding, coordination, and innovation in large and diverse country. We appreciate if you like the video and subscribe to the channel so we can reach more listeners like yourself. Until next time, stay informed, stay healthy, and continue exploring the world of healthcare with us. Thanks for listening.
This podcast is sponsored and brought to you by HealthShare Integrated Solutions.